This video is for general information only. It is not a substitute for advice from your GP, pharmacist, or other healthcare professional. Are you taking cod liver oil every day or thinking about starting? Here's what you actually need to know before you do. Cod liver oil has been a staple supplement in the UK for generations, but like any supplement, it can cause side effects, and for some people, those effects can be serious. Knowing what to watch for makes a real difference. So, what is cod liver oil? It comes from the liver of Atlantic cod, and it's packed with omega-3 fatty acids, specifically EPA and DHA, along with vitamins A and D. The omega-3s may help support cardiovascular health and joint function. Vitamin A supports vision, immune function, and cell health. Vitamin D helps the body absorb calcium and supports bone health and immunity. Now the side effects. The most common ones are gastrointestinal sour, a fishy aftertaste, nausea, heartburn, and diarrhea. For most people, these are mild and manageable. Taking cod liver oil with food tends to help, and enteric-coated capsules are worth considering as they're designed to reduce those digestive symptoms. But there are more serious risks to be aware of. The biggest one is vitamin A toxicity. Vitamin A is fat-soluble, which means it builds up in the body over time rather than being flushed out. Too much can cause headaches, changes in vision, bone pain, and in severe cases, liver damage. NHS guidance sets a daily upper limit for vitamin A from all sources, and that includes food as well as supplements. The vitamin content in cod liver oil varies quite a bit between brands, so check the label carefully, and if you're unsure how it applies to you, speak to your GP or pharmacist. Vitamin D toxicity is also possible with excessive intake, though this tends to require very high doses over a prolonged period. There's another risk that's easy to overlook. Omega-3 fatty acids can affect how your blood clots. If you take blood thinners or antiplatelet medicines, such as warfarin, apixaban, aspirin, or clopidogrel, cod liver oil may increase your bleeding risk. Speak to your GP or pharmacist before starting or continuing the supplement. Cod liver oil can also cause allergic reactions. In rare cases, these can be severe. If you develop swelling of the face, tongue, or throat, difficulty breathing, or collapse, call 999 immediately. So who should be particularly cautious? Pregnant women should avoid cod liver oil entirely. High levels of vitamin A can be harmful to a developing baby. This is a firm NHS recommendation, not just a precaution. Others who should speak to their GP or pharmacist first include people with bleeding disorders, those on anticoagulants, anyone with liver disease, and people with a fish or seafood allergy. If you are taking cod liver oil, a few practical steps can help reduce the chance of side effects. Take it with a meal. If you're new to it, starting on a lower amount and building up gradually may help your body adjust. Check with your pharmacist for guidance on this. And always choose a reputable product and check the label so you know what you're getting. If you notice persistent headaches, changes in your vision, unusual bruising or bleeding, or any symptoms that concern you after taking cod liver oil, contact your GP. Don't wait and hope it passes. To recap, cod liver oil can be a useful supplement, but it carries real risks, particularly around vitamin A accumulation and bleeding. Pregnant women should avoid it entirely, and because the vitamin content varies between products, checking labels and seeking professional advice really does matter. If you're unsure whether cod liver oil is right for you, please speak to your GP or pharmacist. They can look at your full picture, your medications, your diet, your health history, and give you personalized advice. Have you got questions about cod liver oil or other supplements? Drop them in the comments below. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information.